to this week's edition of the Yamhill Leadership Roundtable. We have with us today Mayor Linda Watkins from the City of Carleton. In fact, Casey Kula, Yamhill County Commissioner. We have Councillor Remy Drapkin from the City of McMinnville, way back there. Councillor Drapkin's trees are joining us. We have Al Bannan on behalf of Congresswoman Bonamici. We have Councillor Stephanie Finley from the City of Newburgh. We have Director Lindsey Manfrin of Health and Human Services at the county. Sorry, I always forget to put H.H.S in front, but it's good to spell out those acronyms. We have Carrie Martin from Yamhill County. I am at the moment promoting, who am I promoting? Abhishek Stone from SEDCOR. And then we have a few guests. And I actually, apologies, Nicole Montesano, I promoted you inadvertently in case you wanted to ask questions. But welcome everybody today. And just so that we respect H.H.S. Director Manfrin's time, I'd love to turn it over to her for an update on vaccines, COVID, risk levels, anything that you want to share with us. And way to go in getting vaccines out into our community.
Thank you, Commissioner Kula. It's so great to be here. I always appreciate when I'm able to come here on the weeks that it works for all of us. And so thank you so much for having me. I have a handful of things that I'll share that seem relevant to where we're at today. And then, of course, I'm always happy to take any questions you may have as well. Overall, as you all are aware, our case counts are dropping and have continued to stay rather low in Yamhill County as it has been throughout the state, which is a very welcomed reprieve for our public health team. But even more importantly, that means that the transmission is decreasing in the county. We're seeing less people get ill. And of course, that means great things for our local businesses and schools and things like that beginning to reopen. So we are very excited about that. We're very happy about that. And we will see what happens between now and next week to see if we maintain the current risk level or if we go down again. I think it's still sort of up in the air depending on what happens. We do still want to remind people that even though we are seeing decreased case counts, we still encourage people to continue to follow public health guidance, be thoughtful, be vigilant about those things so that we can keep those cases low until we can get through this and really get to a place of much more normalcy. So we thank everyone so much for their efforts in getting those cases to decrease, and we know that's not easy, and we definitely appreciate everything that you're doing. On the COVID vaccine front, a lot of great things happening related to that work as well. I thought I'd start by just sharing a brief overview of just public health's role in the vaccine efforts. Really, we have two purposes and two roles within this deployment, if you will, of vaccine into our community. One, we do administer vaccines, so we run vaccine clinics, we see people in our own clinic, and so we are actually vaccinating individuals. And then the other role that we play that really is the larger role is the coordination efforts throughout the community. That looks a lot of different ways. It includes working with partners who are doing large vaccine events, Tualatin Valley Fire and Rescue, Providence, and as well as pushing vaccine out to our primary care providers who are vaccinating their patients, and then working with other facilities to help augment what they're doing by providing staffing and support in that way. So we're really working through multiple channels to try to get vaccine accessible in multiple places, because we know one option is not going to work for everyone. So we're trying to get that spread out not only geographically throughout our community, but also in different ways, pharmacies, primary care, large throughput events, our own clinic, things like that. The other piece that we play is really working with community partners on outreach, engagement, and assuring that we do everything we possibly can to make sure that all of those who are eligible for vaccine in Yamhill County know how to access it. Of course, we have not had the vaccine dose volume to assure that everyone who has access has received a vaccine yet. But we want to make sure people know how to get on the appropriate list, how to get contact information, all of those things so that we can have the capabilities of contacting them when they do have an appointment that would be available to them. We have an advisory council that is made up of a wonderful team of people who have been helping us do this work. And then we're working really closely with facilities and organizations like YCAP and UNIDOS as we're really thinking about how we're going to be vaccinating this next group of eligible populations that begin being eligible on the 29th. That outreach and engagement looks a lot of different ways. It is those individuals out in the community registering people using their smartphones and getting folks registered. It's putting up flyers, it's getting information out. It's just really boots on the ground folks that are doing a tremendous amount of work and a tremendous job helping people access vaccine. In addition to our partners, public health does have staff that's, making calls, doing research just to try to find different types of facilities, whether that's, 65 and older living communities, things like that. There have been some cases where we're not able to make contact, and we've actually had staff go on site to try to figure out, is there a way that we can try to coordinate vaccine on site for those types of residences. So a lot of work happening sort of behind the scenes trying to do all of that. We know that there is some confusion about if folks are getting calls or getting links sent to them for appointments, and I'm happy to share a bit more about that process and why it doesn't always look uniform. And part of it, there's really two reasons. Part of it is we, as I mentioned before, a huge role within public health is that coordinating and that overall coordination of what's happening in Yamhill County. That means we work with a lot of different partners, and our different partners have different needs in how they operate those types of events. And so we have really tried to be as flexible on our end as possible with those partners, wanting to get them what they need for those things. And that for some of those events means that a link works better. Other times that we use links is an example would be we are working closely with certain partners like Northwest Senior and Disability Services, where we have really enlisted them, and they've been such a tremendous amount of help to actually call and schedule some of their clients themselves. And in some cases, they're able to share a link for those people to send it out. We have moved away from links in a lot of cases because of concerns around them being shared and folks who perhaps are not eligible using vaccine slots. And so we wanted to be really careful about that. And we've really done two things. One, we really mounted up our ability to make phone calls. So we have a number of staff that are dedicated to doing nothing other than scheduling people all day, every day with the doses that we know are coming to us. And so we're doing that. One of the things that has happened, and this happened last week, is we've got staff who are making those calls, and for a number of reasons, shortly before a vaccine clinic's going to take an event, in this case, it was less than 24 hours before the event was supposed to start, we received some additional vaccine doses that we wanted to be using that week. And so what we did was we continued to call those individuals, and at the same time, because I think at that point we were about 14 hours from the beginning of the event, we went ahead and sent the link out, starting first with individuals on our list who were 80 years plus, waiting a couple of hours and sending it down sort of the list, if you will, to, I think we got down to 70 plus, and then the slots were filled both through the phone calls and through the links. So we've been, again, our goal is to make things as easy as possible, and sometimes there's just no one way to do things and no simple way to make any of it happen, but we're certainly working on our end to do our best to make it as easy as possible. We are not currently taking registration for individuals who are not yet eligible, and the reason for that is because we're trying to refine our process for this. Throughout this entire event, of course, we've learned a tremendous amount, and every vaccine clinic gets better, every time we're scheduling it gets better, every piece. And so we're really taking our lessons learned from this last registration process and determining what's the best way for our community to access getting sort of on the list, if you will, of for a vaccine. And there's a number of things at play. So in addition to us just really wanting to make sure that our process is as easy as we can possibly make it, we are in conversations with the Oregon Health Authority to determine if a tool that they have is going to be to meet our needs. If it does, we will use that. If it doesn't, we'll use something else. And then the other thing at play is our response and how we go about this really is going to vary on the number of doses that we get. And I'll speak a bit more to what we're anticipating here in a minute. But we do know that we should be anticipating an influx of vaccine as early as the week of the 29th and or potentially early April. And so certainly right now we've been operating in a severe scarcity model, right, which takes an entirely different approach and planning and implementation than a model where perhaps we're not in such a scarce supply of vaccine. Both of them take a lot of work, but it's a different type of work. And so we are working to understand and get as close to our estimates of how much we can be anticipating moving forward, because that's really going to help us inform what type of process we have in terms of registering people. The great news about where we're at right now is that we are very excited that we're getting all sorts of indications that, as I said, as early as March 29th, we may be getting an influx of vaccine coming not only to Yamhill County, but to the state as a whole. Just to throw out some numbers, currently we are getting anywhere between 1,200 and 1,400 doses per week. This week is actually our first week where we're actually getting 1,500 doses into the community. I will say, just a quick carve out those, the 1,500 doses that are coming to us today, that does not include doses going to our federally qualified health center, which is Virginia Garcia, and that does not include doses going to pharmacies, but it includes any other doses that are being distributed within Yamhill County. So that's about, this is the largest volume we received to date, the 1,500 coming this week. And we are hearing estimates of anywhere between 6,000 to 10,000 doses per week in the coming weeks. Our best estimate is probably around 8,100 doses is what we can expect as a weekly allocation. And we are so excited to be in a place of having conversations of assuring we have enough access points versus how in the world do we try to vaccinate all these people with so few doses. So it's a really exciting moment. We have amazing partners who are making this huge lift with us, and we are so grateful for them. And so I'm happy to answer any questions about that or the other things. I will just add one more thing, which is we're really, our goal is very similar to what it is right now in terms of distribution, where we have access through some large mass vaccination events where thousands of people can go through in one day. And we are wanting to make sure that we reserve at minimum at least 25% of that vaccine, potentially more for non-large events. So that can be through pharmacies, it could be through primary care providers. Our in-home partners, we've been working with Providence, who have vaccinated close to 150 people in their homes already. We'll continue to do that work. And then a huge part of what we're going to be doing, especially as we're thinking about frontline workers and some of those individuals who are becoming eligible on the 29th, or potentially a little bit later, depending on their role and function, really going on site with employers and vaccinating on site. So we're sort of taking the strategy of doing all of those things, so that, again, not having one way or one place for people to get vaccine. We think it's really important that there's a multitude of options and availability throughout our county, both, again, geographically as well as just in terms of the type of facility and location, because not one place is going to meet someone's needs. So we're going to be as diverse as we possibly can. Thank you.
Way to bring us some good news. I confess that when you said that, when you gave us those numbers, I actually started crying. Which is probably, I know that that's been a very common thing for people when they do get vaccinated. So
it is.
Just crying for everybody else. Thank you, Director Manfrin. Are there questions? I'm sure there are questions, but I guess mine would first be how can people in the community help?
Yeah. Oh, that's such a great question. There are a couple of different ways that folks can help. I think the biggest one is if you are able and willing to volunteer your time, we would love to have you be part of our events. That can be the mobile events I mentioned, or the fixed large vaccine events. We are looking for folks in medically trained capacities, but also not. There's, in fact, the actual vaccinators, the people putting the shots into people's arms, they are critical to the effort, and it's the smallest number of people that we actually need. When we're talking about large events, we need people directing traffic, we need workflow, we need people just to make sure folks don't get lost through the pieces. So there's a lot of elements to those. So those volunteers would be great. And if you are interested in volunteering, if you could email the COVID email address, which is covid@co.yamhill.or.us, that would be great. We are interested in anyone who's willing to volunteer their time. We do have a specific need around individuals who are bilingual, and preferably bilingual bicultural. So if you have folks that you know that might be interested, please, the more you can push that out, the better.
Awesome. That was a great start too. Thank you, Director. And I want to know, Nicole Montesano has her hand raised, so I'm going to unmute her since nobody else is immediately raising their hand.
Thank you.
And I think maybe I was successful.
Yes, if you can hear me, you were. How many doses, second doses is the county providing weekly on average?
Generally around anywhere between 1,000 and 1,400. It's that we're getting at our second doses the same interval as our first. There's very few individuals who are not coming back for their second dose. I mean, the actual total number is on the OHA dashboard, but weekly it's about the same as our first doses.
And you receive those separately. Is that correct?
It's a separate allocation. So, for example, this week we're getting 1,500 first doses, and I believe last week we received, I want to say 1,200. So we'll be getting those 1,200 doses this week in addition to the 1,500. They come shipped together, but are allocated separately.
Great. Thank you very much. Other questions for Director Manfrin? Oh. I've got Joya is directing her finger somewhere.
I put a question in the chat. Sorry, I was directing to the chat. Look at the chat. Anyway, Lindsay, I was wondering, the information that you just shared about the website and how people can register, will you send that out to us, please, or will that come out in an announcement?
So the registration process for those who are 65 and older is still in place. It's been in place for a couple of months now, and it's available on our website, and I'd be happy to link to that for that process. And certainly once we establish the process for individuals to register and sort of get on a list, so to speak, for those who become eligible on the 29th, yes, we will make sure to get that out. Typically what our approach has been in how we've been communicating to the public, and I will say, our media team is small and mighty. It's as you can imagine. I've got some folks that help me craft some things, and they do a beautiful job. But our capacity is quite small. So what we've tried to do is be as proactive as possible in getting information out. So that includes a weekly press release that goes out, and we hope our media partners pick it up and share that information in print. We have a weekly newsletter that incorporates all of these things, and we'll make sure to get the link to sign up for that as well. If you're interested, it's a great way to get information about registration process, who's eligible, just general information of who's been vaccinated, those types of things. We also use it as a time to address frequently asked questions. We get hundreds of questions via email and phone every day, and so we are capturing the ones that are most frequent, and those are available in the newsletter as well as got posted to our website today. And then, of course, working through our community partners. But yes, we can definitely get that information out as broadly as we possibly can.
Awesome, great. Are there other questions for Director Manfrin? Looking for unmuted folks. Okay, I'll get to ask my questions then. So my first one would be, we've seen decreased case counts, and we've also seen a lot of people get vaccinated in the community. Is there a connection that we can make at this point, speculative or otherwise?
You know, it's a great question. I think it's probably a multitude of things that are playing into the case counts, but I would say I would not discount the vaccination efforts at all. I'm certain that they are contributing to that. And I think one of the places where it seems where we're seeing a lot of that is in our prisons and other facilities where we're really seeing a lot of the cases and outbreaks beginning to dwindle, which is a huge relief to those facilities. But I think it also speaks to some of the broader vaccination efforts.
Okay, great. And then the follow-up question to that then, thank you, is I've heard mentions of, we seem to be seeing reduced transmission because of the vaccine. Do you have any sources for like, yes, this is actually reducing transmission? I mean, you mentioned jails and prisons, but that's still kind of hanging out there, right?
Yeah, I don't think that there hasn't been enough time to make a definitive statement around that, although I think everything suggests that is definitely impacting.
Okay, and my last question then, thank you, is I've had people ask me who have concerns. They see people getting vaccinated who are younger, being like 70 as opposed to 80 plus in the community. And your great vaccine weekly update, the vaccination update explains we're prioritizing older populations before slightly younger populations. Can you kind of go into any of the details on how you're doing it? If it's just like by age strictly?
Yeah, unfortunately, we don't have a lot of way to sort of slice data or different things. But for instance, when we're making phone calls, our staff are generally starting, well, not generally, they are starting with those individuals on our list who are 80 plus and moving through that list. Now, what can happen though is a number of things, right? We may make several phone calls where no one answers. We may make phone calls where someone says, I was vaccinated at my primary care clinics, right? So we're going through this list and there's a lot of variability that happens with that list. And so it's not that, so we could be calling all of those individuals and then move to another group because we are, because they weren't answered or various things. So I want, and unfortunately it's not a very 100% linear process, which can make it seem confusing to folks. Plus, primary care providers, pharmacies, other places may be vaccinating individuals who are not 80 plus and who are in a different age bracket. And so all of that plays into those things as well. I would say, the other piece that goes into that is we are still wanting to vaccinate people who are eligible in phase one. We continue to vaccinate people who are in phase one, educators and other people who have been eligible for some time and either didn't get into a clinic earlier, have changed their minds, or for whatever reason, there's still a population of those people that we're pulling in as we are making phone calls and such as well.
Okay, great. That's really helpful. I said, all I have is this little bit of words that I can give to you. And then it looks like Nicole has another question, and I've asked her to unmute herself, so hopefully it works. You'd think after a year of this, I'd know how to do it.
Thank you. Is the county still continuing to receive Johnson & Johnson doses?
We received one allocation of 200 doses, and then a community partner in terms of pharmacy received 100 doses as well when it was initially rolled out. And we haven't received any more. We do anticipate getting some, although we don't know the how much or when.
Thank you. Is the county the one who's vaccinating prison populations, or is that the state?
So the prison that we have in Sheridan, they are vaccinating. They have their own medical team, and they've been able to vaccinate there themselves. And we, in terms of adults in custody, or those who are over 18 in our county jail, we're partnering with our jail partners and medical staff to vaccinate those individuals.
Thank you.
And then there was a question, let me, is there a plan to begin specifically addressing those who are disinterested / afraid to get vaccinated? And I saw via Twitter, oddly enough, former CDC Director Tom Frieden and somebody else have been having this series of conversations with individuals who are disinclined to get vaccinated. So yeah, I'll pass it up to you on that one.
Sure. I think, it's an interesting thing because at this point, it's been a bit like drinking from a fire hose. There's been so many people wanting the vaccine with so few doses, right? And we know that sooner rather than later, and probably sooner than we anticipated, we're going to really see that flip, and we are going to have enough vaccine for everyone who wants a dose, and that's so beautiful to even be able to say that. And there will be a group of individuals that may have some sort of hesitancy for a number of reasons, right? It could be related to the vaccine itself. It could be related to trust of a governmental organization such as public health. It could be for a ton of different reasons. And so, yes, we are working on those types of strategies. We're working closely with our advisory group on those things, who work closely with different communities and are really helping get culturally appropriate information to different populations of people, so that they have accurate information to be able to make informed decisions, as well as access to the vaccine.
And then it looks like Joya has a follow-up question. And I apologize, I'm trying to get Representative Gomberg on here too.
All right, thank you. I'll be brief. Thank you, Sue. This is actually really interesting to be having this conversation. And so I have friends in other states who are lots younger than I am, and it seems that other states are getting through this a little bit faster. And I could be wrong about that. So why is it that we're not moving as quickly as other places, perhaps?
Yeah.
Like states like Virginia and Michigan and California, for example.
It's a great question. And I think what I would ask is, are all of those people who are eligible accessing vaccine, or are they just eligible? I don't know the answer, but that would be my first question. Opening up accessibility, through eligibility may not mean the same thing as getting the vaccine itself. So I think I would have that question, and I honestly just don't know the answer to that, but I think it would be the sort of first question that I would ask. And beyond that, I don't know. I think I would need to see the data around, are they vaccinating more people, or is it just, is it related to more people are eligible but not necessarily getting the vaccine? Yeah.
I don't know. All I know is that I have friends in California who've said, yeah, I got my vaccine, and I've got family in other states that are in their 20s and 30s that are getting the vaccine. And I'm like, well, why is that happening there and not here? So that's just curiosity more than anything else.
Yeah. And I will say we do see individuals who don't meet the eligibility criteria in Oregon getting vaccinated. And, we have been really cautious and thoughtful and doing all that we can to assure that those who are getting vaccinated are eligible. And we know that there are places that have that aren't required to follow the OHA guidelines and have been vaccinating a broader group of people.
And then it looks like Mayor Watkins has a question, and I wanted to welcome Representative Gomberg as well. But let's go to Mayor Watkins first.
Yeah, it wasn't actually a question. It was just kind of a comment, follow-up on Joya's question, I guess, which is it possible that just some of the states that she was mentioning are larger population states, and in the process of sending out the doses and the allocations, they're getting more doses, and it may seem like they're going faster, but maybe on a pro rata basis, they're not. It seems that way because we're hearing from more people. So just a thought. I don't know.
Joya is so expressive even while she's muted.
You know why I'm Italian, right?
Yes,
Sorry.
totally. Are there any other questions or comments for Director Manfrin? All right, I've exhausted all of my questions. So thank you, Director Manfrin, for joining us today. Keep up the good work. And remember, send an email to the covid@co.yamhill.or.us if you want to volunteer. All right, then what I'm going to do right now, I asked people to be prepared to talk about the COVID funding or the federal funding package. And I wanted to first invite Al Bannan to speak with us a little bit about what more Bonamici's office might know And then we have with us also Carrie Martin from Yamhill County, who has put a lot of work into understanding the eligibility requirements and the reimbursable, the eligible expenses. So I wanted to hear from Carrie Martin as well. Al, take it away.
All right, ready for some numbers, folks? So we know the American Rescue Plan is providing $350 billion in new coronavirus relief funds for states, localities, tribes, and schools. Yamhill County will receive an estimated $20.77 million. I just put in the chat a fact sheet with estimated city allocations for the district. And the bill also includes critical funds for school districts, and those estimated school district allocations are also included in the Congresswoman's fact sheet. I'll go over sort of like the top line. Moral of the story is we're still waiting for guidance. I know there's a lot of questions on when guidance, including more detailed lists of allowable uses for the funds, will be available. We have been in conversation with the U.S. Treasury, and we'll share that guidance as soon as we receive it. So next time I know more, I'll hop on here and go through that with you all, and I can send it to Commissioner Kula as well. So we know that the funds can be used to invest in water, sewer, and broadband infrastructure, as well as premium pay up to $13 an hour in additional wages for many workers performing essential functions. They cannot be used for pensions or tax cuts. $20 billion is reserved from the total state fiscal recovery fund for all federally recognized tribes. Governments will receive their allocations in two tranches. The first 50% will be available approximately 60 days after the bill was enacted, and then the other 50% will be available 1 year to that date. And then counties so Yamhill County will receive the funds directly from the U.S. Treasury Department, and states will receive the funds for all other cities, not including larger cities, which will receive the funds directly. There are none in Yamhill County that fall within that jurisdiction. And then the state has an additional 30 days to distribute those funds and does not have the authority to change funding levels. And then importantly, the funds must be spent by December 31st, 2024. And that's what I have for top line for now. Happy to answer any questions. Caveat saying I will likely say, great question. Let me reach out to my ledge team and get back to you.
That sounds great. Thank you, Al. It looks like Councillor Drapkin has the first question.
Mine are easy because they're just clarifying points on what you said.
Sure.
So you said the certain portion will go to the city, or will go to the county, and then the rest will be distributed by the state directly to cities. Can you hear me?
No, you're breaking up a little bit.
Sorry, rural broadband. You said some will go directly to, some of the funding will go directly to the counties, and then some will go directly to cities via the state.
That's correct.
Okay, could you clarify how we will know what's going to county versus other cities? And then my other clarifying point is you said funds must be spent by 12/31/2024? 2024?
Yep.
Is that correct?
Yep, that's correct. 12/31/2024 for funds to be spent by. And to clarify on the state, so the county will receive all of the first 50% within, what did I say, 30 or 60 days after the bill was enacted, and then the full 50% after, and that'll be direct from the department, the Treasury Department, to the county. For cities, the funds will go to the state 60 days after, and they have an additional 30 days to then get those funds from the state to the cities. So some larger cities like Portland and Beaverton will get the funds direct from Department of Treasury to the cities, but all of the cities in Yamhill County will be getting their funds. It'll go Treasury, state, cities in Yamhill County.
So it could potentially be 90 days before cities would then receive funds.
Correct.
From last Wednesday or whatever.
From when the president signed the bill.
Yeah.
Yep, okay. Which I am not saying what date that was because I don't remember, because time has no meaning. But yes, from the date that the bill was signed.
Okay. Thank you.
Yes.
Okay, great clarifying questions. Other questions for Al at this moment? You know, the Congresswoman yesterday or last week, when we talked, she was like, "Oh, and by the way, we're working on infrastructure next." Because I was like, "Can we use it for this infrastructure project and this infrastructure project?" So, oh my gosh, sorry, my world is making noise. It looks like Councillor Finley and Mayor Hill both have questions. Let's go with Mayor Hill first, since he was the first one I saw.
Al, this isn't a question, but I just want you to take back to Congresswoman Bonamici how much we appreciate the individual approach she's made. I got a phone call last weekend to just reiterate that the monies were coming, the amounts for McMinnville, and so just thank her for that personal touch.
I absolutely will.
And Councillor Finley.
My question is for you, Casey. What was the answer to that? To your questions about infrastructure and what we can spend it on?
Yes, that was the answer was yes. But I was standing out in front of a bookstore, and children were running around. So what I was gathering is that Congresswoman was like, "Well, remember that really costly, like high value infrastructure projects, you should really be thinking the infrastructure bill as opposed to using these funds that are coming to the cities and counties and just below them, as it were, on an infrastructure project when there's likely another round of funding going specifically for that."
Okay,
but
good,
it was
thank you.
the eligibility. I'm going to go to Carrie next on this one, but the eligibility is pretty clear that infrastructure projects like water, sewer, broadband are eligible expenses.
And I'll just say, just to add on to that.
Does that satisfy you?
Sorry? Maybe there was a delay. We're good. I'll just say to add on to that, I hope that this is obvious now at this point, but, to Mayor Hill's point, the Congresswoman is really prioritizing making sure that that she is in very frequent communication with leaders in the county and figuring out what are needs and making sure that you all know what's happening in DC and when things become available and really getting that information across. So I will be continuing to come to these meetings as we move out of this American Rescue Plan and into the infrastructure bill, and we'll have lots of transparent conversations about what that process is looking like and how we can stay in conversation as that bill gets built out.
Sounds good. And then it looks like Mayor Hill has a follow-up.
Sure.
And again, I think one of the aspects of these dollars are to replace revenues that may have been lost via COVID. And one of the things we're looking into is probably one of the greatest hits that we as cities are receiving is a reduction in transportation dollars that come from the state gas tax, because the fewer miles being driven, less gas tax. And so that's something that we're looking into, but not to understand that there are infrastructure dollars coming for transportation from another source. And Casey and I have been very involved as we're looking at the Newburgh Dundee bypass of trying to get ourselves in a position to be shovel ready for phase to the finish, as we call it. But that can be other types of transportation needs if we can get to shovel ready. And one thing that we're looking at is what we might be able to do in the downtown McMinnville area, 3rd Street, because we're going to be doing a 3rd Street streetscape, and we kind of get a sense of what shovel ready, meaning the design, would look like, and we're talking about those things also. So there's a number of different pots of money, but transportation could be one that could truly help our communities out, because we rely so heavily on the state gas tax.
Yeah, thank you, Mayor. And then I'm going to pull in, unless there are further clarifications or questions for Al, I'm going to pull in Carrie Martin now, because she has looked specifically into the the information for cities and counties. So welcome, Carrie. And I didn't even give you an opportunity for the last call, but any questions directed to Al? Al's available right now. Go.
Okay. Well, I appreciate the confidence that that Commissioner Kula has in my abilities to predict some of the funding information. And although I am sorry to report, I don't have any answers. I am also waiting for the same level of guidance that everyone else is. I've certainly read through the plan, and one of the issues that Casey and Mayor Hill brought up is really the thing that is most on my mind, which is making sure that we use the correct funding pots for the correct projects, and that the cities and the counties don't over allocate their resources to projects that might be covered at the state level or by other agencies. And so those are really the things that I am most interested in, to make sure that we really maximize what we're able to provide locally. So that isn't that isn't adding much to the conversation. So.
But yeah, I think, Carrie, I think your comments are, it's obviously very important with the different areas that Al has presented where money is coming for this and that cities and counties should be very careful to not try to work on a project through their own direct allocation that's can be funded through the child care one or, the Timber County payments. So I think it's important.
I hope that there are a lot of these conversations that continue as people are considering investing in different projects and who might be logical partners for that, so that we can really leverage and maximize the dollars. Right. Thank you. And then what I'm going to go to next is I'm going to go to Abisha Stone, because she thinks about this from a regional or a sub-regional scale. And then I'm going to want to make sure then she has to leave early. And then we hear from Representative Gomberg in his weird session year. So thank you, Abisha. And then on to Representative Gomberg.
Thank you, Representative Gomberg, for letting me jump in front of you, because I do have to jump to another meeting. But I really appreciate the comments that Carrie made about making sure that we are using these resources coming our way to maximize the impact, right? So those of you that were in leadership or even just lived in Oregon in the late 80s might remember the really extreme economic impact that was felt to the timber industry. And then the wood forest products industry all felt around the spotted owl, right? So maybe those of you who are in leadership might remember that. Those of you who just kind of were in the area remember that. Well, that was a huge that whole industry was a very big industry, obviously, in Oregon. And so the impacts associated with that were enormous in terms of economic impacts for the state. Where I'm going with that is that what came just after was a lot of relief money. A lot of funding started coming through the EDA and the feds and the state saying, how do we approach economic recovery, not just for this specific industry sector, but at a state level, because the impact was so big. Well, quite a few folks that I've been talking to who have been in leadership doing economic development in the state for enough years to remember that have been comparing what we're seeing now coming down the pipe in terms of resources to that period of time and saying, be wise, be planful, be mindful. So something I sincerely appreciate about the funding that came through this last package is that it is coming in two tranches of funding, and that we have until 2024 to spend it out. Some of the discomfort associated with the CARES Act funding was that we had a very short period of time to identify what the needs were, how best to serve those needs, how to execute distribution of those funds. So a very short timeline to get that done while we were still learning. We were still in the middle of the trauma of the issue, and the rules kept changing, right? And that's very difficult to navigate. And we all want to make good decisions. We all want to make sure that we're putting these funds where they have the greatest, most long-term impact. So I appreciate the fact that the way the funding is coming into the community, the amount of time that we have to spend it, gives us time to be planful, So the update that I have to share with you is that that's what we're trying to do. That's what we're looking to do. So I submitted to the Board of Commissioners recently a recommendation for a planned approach in creating areas of strategic focus for economic recovery. At the end of the month, on the 25th, the Economic Development Advisory Council for Yamhill County. This is the council that advises on the work that SEDCOR does, and they advise the Board of Commissioners in the area of economic development, will be led through a strategic process to develop their recommendations that will be submitted to the board for review. We also continue to work with groups like the Newburgh Workforce Housing Consortium, and we have multiple sort of childcare programs. We continue to work on the broadband expansion program, but these are essentially programs and projects that have come out of early prioritization. So going into this year and next year, we're hopeful that this work coming out of the EDAC, going through the Board of Commissioners, will give us the areas of focus that will drive our energies and ultimately dictate how these funds are used. And like Carrie said, of course, that will also be driven by what are the requirements and parameters for spending these funds. So it's a lot of things to align, but I just wanted to share with this group that that's the type of work we're trying to do. Thank you.
Well, thank you, Abisha. It's definitely, you and I have talked about the timber wars, the decline of rural Oregon communities around timber. And we've also talked about workforce training around that. So I appreciate bringing it back and saying, how do we learn from the mistakes or the losses and the missed opportunities in our community. And since I was a little kid, I was careful about not saying mistakes because I wasn't the one making the decisions, so I don't want to judge them. But thank you for that, Abisha. And Representative Gomberg, welcome. And you've got your tie on and you've been sitting through meetings on screens. How are you? And thank you for joining us.
Well, actually, I'm here in Salem. Thank you very much. You'll recall that that while we're having all of our committee meetings remotely, to actually vote on legislation, the Constitution requires us to be here in the Capitol, in the chamber. So we started this morning. We worked through the lunch hour. We're going to be coming back after committee meetings this afternoon and meeting this evening, trying to catch up with the flow of legislation. A little bit more about that in a moment. I just wanted to say I really appreciated hearing the overview on some of the new dollars coming to us from the federal government, coming to cities, coming to counties, and coming to the state. Goodness, I don't know if many of you are old enough to remember this movie, but it sounds like a scene in Brewster's Millions, where you've got just a set amount of time to spend a lot of money, or you don't get to keep it. Yeah, we need to make sure that not only do we spend that money, but we spend it well. By the way, the federal dollars coming in this round is probably going to make it possible for us to balance the state budget at the current service level. Right now, we've been going through a series of exercises looking at how we can reduce current spending and current programs by about 7%. And that would be affecting healthcare, education, transportation, public safety, and on and on and on. So this was the shot in the arm that we were looking for. Some of the things we're talking about right now include a proposal that was released this week for summer programs for kids, aimed particularly at trying to help our young people recover from a year of remote learning, even if they have to use the summer months to do it, with summer education, summer activities, and summer childcare to help parents out who otherwise would be home with their kids. So that's a package that's moving forward. There's also a similar large package moving forward dealing with housing and homelessness. So those are good things. Yeah, we're behind schedule. The Capitol right now is fraught with frictions and divides and frustrations. We've already had, depending who you ask, it was either a walkout or a protest, one way or the other. The Senate ceased to do business because they couldn't reach a quorum. On the House side, one group of legislators is requiring that all of the bills be read from cover to cover before we can vote on them. Normally that's not done, but using parliamentary procedure, they're requiring the bills to be read. What does that mean? There's one bill sitting on the clerk's desk right now that was scheduled to be heard this week. It's 170 pages long. And you say, well, gosh, why should any bill be 170 pages long? The way bills are written legally, there may be one new word on every third page, but you have to have the whole thing there for it to provide some context. The clerk's office is estimating that one bill will require 17 hours to be read. Yeah, wearing people down and increasing the level of frustration, that's not a good thing. By contrast, I will tell you this afternoon, I am making a presentation to the county college. Commissioner Culla, you went through county college when you were a new commissioner. I've been asked to meet with the county college and talk to them about building relationships and working with people, even though you don't entirely agree with them, trying to find common ground. That's a couple of the things that we're going to be talking about this afternoon with new county commissioners. The final thing I'll share with you, well, two things I wanted to share with you. One related to COVID, and I guess the news is fairly good that positive rates are coming down, and that vaccination rates are going up, that businesses are starting to open, kids are getting ready to go back to school. One of the things I am hearing is to be very guarded about the potential for vaccine fraud, people that will take advantage of the situation to try and get information or money from you. And the general advice that the state has been giving is to be very wary of phone calls, and particularly if anybody asks you for money or for personal information. Now, honestly, I'm not sure what the process is in Yamhill County, but in one of the counties I represent, the county health department is actually making phone calls to people saying, you're on the waiting list, we've got an appointment for you, we'd like to sign you up. And I don't know how that meshes with the message that we don't want you to talk to people who phone you up because they may be trying to defraud you. So, if you're talking to people in other counties and they're asking about phone calls, the bottom line is don't give any information about credit cards, gift cards, or bank account numbers away. The final thing I'll share with you is spring break is coming. Gosh, I don't know what spring break really means when kids are staying home, and a lot of times parents are staying home with them, but it's traditionally a time when people get out and about in Oregon. I will tell you that I'm not seeing a lot of people on the call today that are actually from my district, but I hope if you're not from my district, you come and visit my district. And when you do so, we just simply ask that that you be respectful, that you use good judgment, and that you spend lots of money while you're there. So, come on over to Sheridan or drive further west, spend some time in Grand Ronde. Welcome to the 10th House District. Commissioner, I'll try and answer any questions that I can for folks that are on the call, and then I'm going to have to run to another meeting myself.
Okay, that sounds good. Thank you. Are there questions, comments for Representative Gomberg? I confess that I will be over in your district soon. But, visiting parents. Joya.
Thank you. It's good to see you, Representative Gomberg. Thank you for being here today. I know you've got to scoot really quickly. Just one thing, there's been a lot of unemployment fraud as well. And so I think it's really important that we be aware of that as well, particularly businesses and individuals. I know someone that this happened to, so I'm just putting this out. And I wondered if there was anything happening that, perhaps the employment department was implementing to stop that.
Well, funny you should ask that question, because I had the employment division in front of the committee that I chair, and I asked that very question, that we're concerned about fraud and people trying to submit information, pretending to be a business and getting money, or pretending to be a unemployment recipient and getting money. And the employment division had a really very fascinating answer to that. And the answer in summary is, We know there's fraud. We know what's going on. We're doing our best to fight it. We're not going to tell you the details because we don't want to make public what we know, or it'll make it easier for the bad guys to change their practices and take advantage of us. I leave it to you whether that's an acceptable answer. It's certainly an interesting answer. Yes, there's a lot of fraud out there, and the state's aware of it.
We don't disclose sources or methods, right? That's what they're saying. Okay, great. Thank you very much for joining us. I don't see any other questions at the moment. Yeah.
Thanks, everybody. Keep doing good things.
Keep working with other people. All right, and we're winding down our time. So if you don't need to do any updates, just tell me pass, but I'll get us going. Councillor Finley from the city of Newburgh, what would you like to share with people today? And it's good to see you.
It's good to see you too. So I'll make this really short, but we have lots of exciting things going on in Newburgh. We had council just last night. We are, as is everyone, dealing with affordable housing. You know, it's not a new thing for anyone, but we did get some updates on some middle housing stuff going on in Newburgh, specifically duplexes. And so we had a big update on that last night. And so we're excited to start working on what we can do about those issues. We're excited as we lower our risk levels that the library is back open. They had been servicing people all along, but now we get to see them in person. So we're really excited about that. Last night we added youth to each of our committees and commissions that it makes sense to. And so we will be expanding our youth volunteers on each one of those committees. So if you know a kid in Newburgh that is in late middle school or high school that wants to sit on a commission or a committee, we'll have some openings coming up. We are still in the middle of the beginning stages of our police chief recruitment, and there have been some surveys going around on Facebook. If you would like to weigh in, or if you know someone in Newburgh that wants to weigh in on the kinds of things we should be looking for in our next permanent police chief, that's the way to do it. But we're excited to continue to work with our consulting company to get that rolling and hopefully be welcoming whoever is going to sit in that seat sometime this summer. And we are continuing to work on our urban renewal and our waterfront master plan. So those are really huge projects that we are embarking on, and it's gonna cost a lot of money and take a lot of time and a lot of resources, but we're very excited about that. And then our hot button issue right now is the Elliott Road improvements. That is the road that leads from Highway 99 up to the high school and the middle school and one of the elementary schools. And so that has been a tough discussion and something that, you know, we're really struggling with how to best serve the community at large and also the people that live on that street. So we're hoping to break ground on that project hopefully this summer sometime. So that's what's going on for us. Thank you.
Awesome. Thank you very much. I even saw a public relations campaign around the Elliott Road. So way to actually communicate with people. Okay, great. I'm going to go to, oh my goodness. How about Mayor Hill for my next one? And I have to be out of here in theory at 2, but we'll squish it in a little bit.
Yeah, I'll go very quickly. Thank you, Casey, and those on the line, and the reports that have been received, very timely and very good. Last Friday and Saturday, we had our consultants work with all the communities that are looking at the Willamette Valley Fire District. That would include Amity, Lafayette, Carlton, Dundee, Dayton, McMinnville, and McMinnville Rural. And we're moving forward with the next level of preparation and analyzing the feasibility of the economies of scale of the fire district. We're continuing to work on our goal setting. Remy had to drop off, but we had our first DEI committee meeting last week, and it was phenomenal. The area, the group that has such good experience and passion. We're looking forward to that. And then as Stephanie indicated, with the moderate risk, our summer soccer program, we're taking reservations for that program now. The aquatic center is going to be opening. The library is opening. Community center is opening. And at some future date, we hope fairly soon, the senior center will be opening, but that is a critical group of people that we want to make sure that we're in a proper position to do that right. Thank you.
And it'll be a great place for vaccine distribution too. Yes, okay, thank you very much, Mayor. Mayor Linda Watkins from the City of Carleton. But you're muted.
Sorry, I'm in a hurry and I'm wasting time. So I think top priority is that we are having conversations with ODOT regarding our reroute in town, which hopefully it's still not been received all of the blessings that it needs yet, because it's just working its way through the ODOT process. But we're hoping that that will be done and they will be able to get started on that. Because of some things that happened, it's been pushed back a year just because of the delay with the discussion about the West Side Road thing. But hopefully we are on track and, we'll be getting started. And I've reassured the ODOT that, at least from the town, we're full speed ahead on that and supportive of it. So that's where we are there. Other than that, not a lot. We're watching the COVID regulations pretty closely. The one thing that's kind of going to be hard for us is that the kids in town really, really, really like having that swimming pool in the summertime. And it's looking like there's a good chance that it may not open again this year because of the way they're setting up the regulations. Why an indoors covered pool would be okay and an outdoors uncovered open pool is not, I'm not 100% sure yet, but that seems to be where the direction that it's heading. By April the 1st, we've got to know, because we've got to start, making our plans then. So our fingers are just kind of crossed right now. But the last time I talked to our city manager, what she was hearing was not looking good. And I'm not really excited about telling the people in town about that. But all of our restaurants are open, and Friday nights and Saturday nights in town are looking really good. So we're happy about that. So that's it.
Great, thank you, Mayor. And I'll check with people that I can check with about the pool situation. It seems like one that when situations have been explained in the past, the OHA has allowed for different interpretations. So.
Yeah, where they were at right now is you could have 8 kids in the pool and they had to be spaced 6 feet apart, which is a little bit, probably not going to work. But, and then apparently they were looking at even increasing some restrictions there. So I don't know. It's just distressing. We've got it.
Okay, I'll work on it. It is really important space.
Yeah, it is. Yeah. Anyway, so that's really about it for Carleton right now.
Casey and Mayor, as I look at my chart on moderate risk under swimming pools, it's called outdoor recreation fitness establishments. They're saying that there's a maximum of 150 people that can be, and it doesn't designate between outdoor or indoor. So if you go to the Oregon Health Authority's risk level guidance, that tells a little different story.
I will check. I will have a meeting with our interim city manager tomorrow and try to check again. That was the last I had heard from her. So I will ask again and see what's going on. And Casey, I will send you an update on that before we start asking too many questions. Make sure we got the right information. Well, I want to make sure we have the right information before we start whining too much. Yeah. Okay.
That sounds good to me, Mayor. Yeah.
Thanks.
Thank you. Thank you for that clarification, in both of you. Yeah, absolutely.
Yeah.
And then Joya Goodrum, we have time for you. Do you have time for us?
I do, and I really appreciate you. Those of you that are still here hanging in, I'm going to be very brief. So I just wanted to let folks know that on the 22nd, which is Monday, all of the SBA wants all PPP applications in. So if anybody is trying to still get money for a PPP, it's got to be in by Monday, which is the 22nd. I got an email today that McMinnville was the 19th safest city in Oregon. So yay us. And I didn't look at any other cities but ours, so I apologize for that, but I was pretty excited to see that. 3rd Street was impacted by their lights, and Dave is not here today, but I wanted to let folks know that if they wanted to support the Twinkle Lights on 3rd Street, they are fundraising. So they're 3/4 of the way there to pay for putting them all up again because of that. So if anyone would like to generously make a donation to MDA, I'm sure they would be thrilled about that. And Travel Oregon has a competitive and recovery grants program for eligible applicants. What's wrong with me today? Our local governments, port districts, federally recognized tribes, nonprofit entities, and Oregon-based tour operators. If you've been impacted, there is money out there from Travel Oregon. And that's all I have. And thank you. I went as fast as I could. I appreciate the time. Thank you.
Thank you. And along those lines, I put into the chat, but I should speak to the public about this, that the Shuttered venue operator grants are now live, and you can apply for both PPP and the Shuttered venue operator grants. But that if you get the PPP, then your Shuttered venue operator grant will be reduced by that amount. But for some, it's been a very important thing. So I'm glad to see it's finally out there. Okay, thank you very much, Joya. You know, my typical update is really the one that Director Manfrin gave us, so hooray for that. Remember out there, we still have the virus around us. Even though case counts are going down, let's keep the mask wearing on, keep your distance from now, and we're gonna get through this. All right, thank you very much, and we will see you next week.